I'd love to know more about how your experience was. Is maternity leave happens and you come back to work and then people are just right back to business, and it's just like something major has shifted and priorities shift, and like you said, there's no book that can prepare you. There are also many physicians who, once they experience motherhood and childbirth, they feel like it's too early to leave their kids at home, or maybe their priorities in life have shifted. And so it's interesting because I don't think a lot of conversations like that happen when someone returns back to work after maternity leave. Because everything you think about, like just career planning, life goals, it all shifts and there's nothing to prepare you. And I'm curious as to what that was like for you.
I absolutely agree with that. There is nothing that can prepare you. The first time I was a resident, I still remember when I went back on my first MICU shift, which was, so I had my maternity leave. I had a little bit, I believe, a week or a week and a half of research, and then straight to MICU nights. So I'm in the ICU at night, and I call my husband sobbing from a bathroom that I can't do this. I just can't do this. I am missing you guys. I want to come home. I had a C-section. I still feel like my scar is hurting. What he said in that moment really carried a lot of weight for me. And that's a similar message that I've listened of support. And that was, he sent me a selfie of him and my daughter. And then he said, we're fine and we're not quitters. Don't come home. Do your shift. And he's very much like, on point with that stuff. But if he had also been like, I guess this is it, come on home now. And so I think in that moment when I was sobbing in the bathroom, that's what I needed to hear. And it helped reground me in a positive way, like the tone, the way the text was sent. Because, if this had been sent in a different way, the context really matters. I could have been angry. And I'm like, no, I'm just done with this. It was a moment of recommitting every day that I want to be a doctor. I want to finish my training. I love taking care of my patients. I love this. And so I want to finish my training. It was a question that I had to ask myself and a recommitment pretty much on a daily basis after entering motherhood. So that was hard. But on the other end, I feel like in a strange way, because I was so supported overall, I was able to navigate the first episode of postpartum depression better. Or maybe I hid it under overworking because even with all the support systems, being a resident is being a resident. So I don't know what a good way to piece that apart would be, but I did do better overall when it was my first time around. The second time around, I was looked at somebody who had more choice as an attending, as an early career attending. I had more choice. And everybody was like, what? It's her decision. It's no longer like you're a resident. I need to put things in place for you. You have things in place for yourself. Yeah, you're going. It's your choice. And then every day I was like, am I doing the right thing? And I feel like I don't get to hear dad guilt quite a bit, but we get to hear mom guilt quite a bit, right? So things that I was missing. And so I did decrease my FTE, which helped me. It helped me stay calmer. Taking the medication helped me. Going for coaching and counseling helped me in that moment. But I needed a lot of layers for help. But yeah, the day you walk back into the clinic, the settings that you practice in, wherever you're at, you will, depending on how nice your colleagues are, like I had such one of my most amazing colleagues, Sarah Youngblood, she's a nurse practitioner. She had left this cute little mug that just said, keep the tiny humans alive. And then she had a card next to it. That was such a thoughtful gesture from Sarah that just helped me get through that day. At large, though, because again, it's business as usual, right? And I think part of that is I get it because everyone else around me, I get it, they're busy. But something shifts in you internally and it's hard. And in that moment, I wish I had been more patient with myself as well. Like I was also, whoop, we're back. Why does your body still hurt? Oh my God, why do you have to go pump? Why do you have to do all of this? Blah, blah, blah. So even with my own self, I was like, okay, I am back. Dr. Shabbir needs to look perfect the first day she's back postpartum. And that was harder. And so if I could have been more patient with myself, it would have been helpful. But when we step back and even in the clients that I've coached, we've had to ask for some really basic things that it is ridiculous. Like the fact that you have to pay back, RVU loss for taking time out for pumping, problems with, okay, if you're pumping in clinical settings, that's not okay. Or, well, what are we supposed to do then? And so there have been, in the clients that I've worked with, a lot of really ridiculous things that we have advocated for and thankfully been able to change, but also recognizing that in those moments, a lot of times women physicians are like, again, questioning themselves, like, well, I don't want to be an inconvenience. Excuse me? You are not being an inconvenience. This is literally workplace accommodation that needs to be in place for you. A lot of amazing physicians that just walk into spaces, and all clinicians, like whether it's APPs, whether it's nurses, any member of the healthcare team, everyone deserves to be supported as much as they're supporting their patients. And so in those moments, instead of questioning yourself, no, your concern is valid and you have to advocate for yourself. So I think that there is this huge part. And another thing I will add to the above, Dr. Singh, is recognizing it's okay to be flexible at this point. So when I dropped my FT, I was still a full-time employee, but just dropping my FT a couple of notches, I felt like such a colossal failure again. Like, okay, this is how it starts. And so in my mind, there was a very rigid way that you were the perfect doctor and there was no room in the middle for anything else. I'm thinking if I should say this on air. I'll go ahead and say it. It saddens me to say this, and this happened after becoming an attending. I went back for a fellowship after 4 years in geriatrics. And this was at the second year of the pandemic. The daycare kept shutting down again and again. We're struggling with childcare in terms of nannies, sitters, all the things. And so that's a huge separate bucket of like, where is my village? Who is my support system? And I remember being in a lecture and getting called from the daycare that, oops, we're back in quarantine for 3 weeks, figure it out. Meanwhile, we're both working. My husband's building his business at that time. He's super busy. I am busy. I'm a fellow again now, which was interesting. And I thought, wow, my kids are such a nuisance. My children are a nuisance right now. And I've written an article to my own self and I never sent it anywhere, which was that title, that actual thought that I had because of lack of support. And also this fear, like, what's the fault of the other fellows that are going to have to cover for me? These are all things that we think because we're actual human beings and we want to be as present. Like, I always want to be that person for my team. I did the most amount of respiratory care unit shifts when the pandemic happened because my other colleague was expecting. Some of the attendings in my practice, there were older adults, and I was like, I will do all of this for you. Meanwhile, both my kids were toddlers at that time. So, yeah, the very real fear of bringing it home to my own family. But I was like, well, that's what you do. You show up for your team. And so in those moments, I felt that motherhood and medicine, it was really hard to create those spaces of coexistence and feel like you're being excellent in both spaces. So I may not have the answers to all of this, but I at least openly sharing about what was happening in my mind. I want to normalize it for you. And this is a very shameful thought when I look back at that moment when I thought, like, wow, my kids are such a nuisance. Because we have to pretend both things, right? My role in medicine needs to pretend that I don't have children. And my role as a mother is this understanding that, yeah, she works. Like, that's just one part of it. But she also has to do all of these other things.
Your honesty goes straight to the heart. It's amazing because, this country, just looking at how we live compared to the rest of the world, despite all the brokenness of our system, it's still one of the richest places to live in our access to care. And I will just flat out say that we are one of the poorest healthcare systems, especially with respect to women's health and like embracing the humanity of the experience. Because so many things you had to acknowledge, like even with the clients you coach about things you had to advocate for, the postpartum leave, maybe 6 weeks, maybe 8 weeks, maybe 10 or 12, and some still go back after two. I know you've seen it. I've seen it where colleagues go back 2 weeks after C-section. And that's exactly the time when all these physiological changes are happening. The highest risk just after pregnancy, right after giving birth, in the first few months is for postpartum depression. So then you internalize all this, like you were explaining before, this isn't going to happen. Or it's like the fault is in me, when it's completely not. And none of the system is there to support either. So it's kind of just like, what can you control? What can't you control? But then it's also having this awareness of it. You have so much awareness of it because there's so many physicians that I've seen too that will come out of this and not even realize what's happening to them until they are so severely depressed and wondering, how did I get here?
Yes.